that as I've had no medical...
Will we switch on the mic?
I'm just not, haven't got it close enough. Okay, so just to say for the record that as I'm not trained in medicines, that I'm not giving any medical advice, and only doctors can do that. My field of expertise is in health, so if I use any words such as cancer or cure or anything like that, I will be spelling them with a K and not a C, and anything that I say that is accidentally in any way offensive to anybody at all, I'm just saying it ironically and humorously, and I'm not to be taken seriously on anything that I say. And I advise all of you to double check any facts, because I have listened to recordings of myself in the past and realised I've said something silly. So check everything yourself. Now, let's just start with birth, because I think the children thing is rather important. How many of you know that children have language on the first hour that they're born? They can communicate the essential things with their mother or their father, or anybody who hears. It turns out that a baby has 5 communicative sounds that it makes from the moment of birth, and it's so obvious what they are. If the baby is hungry, it makes an oo sound, because that's the shape that it makes when it's sucking. If the baby is tired, it will make an ah sound. If the baby is in discomfort, it might make an sound, and so on. Now, if a mother is attuned to what these noises sound like, she will respond and be able to feed her baby or wind her baby, whatever it is necessary. If the mother ignores it, after the baby has made the noise twice, it turns into a cry. So there are mothers who have learnt their baby's very simple 5-word language, and so those babies have never needed to cry. There has been no requirement for the baby to cry because they've never got to that stage of frustration. So if you want to learn about this, it's on YouTube. The woman is Patricia Dunstan, and you can see how to learn this. So I think with birth, people are most worried about birth defects, things like muscular dystrophy, cystic fibrosis, Down syndrome. Did you know that at 2 months you can see a Down's baby in the womb? Now the doctors might say this is a chromosome issue, it's hopeless. This is not true. Anybody from the health field would recognise that the mother is low on selenium. If you are low on selenium as a pregnant woman, you risk a baby with cystic fibrosis, muscular dystrophy or Downs. There have been recorded cases where the mother with the 2-month-old Down syndrome baby in the womb has taken all the supplements that they needed and the baby has been born normal. Right? Why don't we know this? Why don't we know that you can reverse Downs in the womb? That's because doctors aren't taught. And clearly, while the doctors are paid by the number of ill people on their books, it's hard to see where the incentive might be, because it's certainly not financial, to fix anybody. And you'd think that doctors would be taught health in medical school, but at some point, you know, the lesson would be health. What does it mean? What is it? And healthy people would come in and explain how and why they're healthy. So, obviously this doesn't happen. On average they do half a day on health, so that's half a day on minerals, vitamins, amino acids, essential fats, diets and everything else. And because it's only half a day, it's not really considered important. So many times clients come to me and say, well, the doctor said broccoli isn't important. They said what I eat isn't important. And it's so clearly farcical, you've got to really laugh. So, could one empty the hospitals in a year easily for a cost of a few £100? Yeah. How many people, when asked, are your symptoms worse in the winter? Does it get better in the summer?
you'd be surprised how many people say, oh, it's much better in the summer. So it's pretty obvious it's a sun problem in the winter. You know, I went into the doctor's office and looking through their brochures, because I like a good laugh from time to time, and I picked up the one about the flu vaccine. It said, the flu season is coming, the flu season is coming, get vaccinated. And, I mean, what do they exactly think the flu season is? And it's obvious that flus and colds happen in the winter, therefore it's a vitamin D deficiency syndrome. It's not a flu epidemic, really, it's a lack of vitamin D. So what happens when somebody gets a cold or a flu? What really is going on? Well, 10 years ago, I was working on and off with a medical doctor, really a genius medical doctor. He runs a RNA company, anyway. He said to me, you're low on vitamin D. And I said, what do you mean? He said, well, it's winter, you're in England, everybody's low on vitamin D. I'm a doctor, I know. So I went to my GP and said, I think I'm low on vitamin D. And he didn't want to do a test, but he did. And 3 weeks later, the test comes back, and he says, how did you know you were so chronically low on vitamin D? And I looked at him and said, well, it's winter. You'll find all your patients will be chronically low on vitamin D, more or less. He had no idea, never crossed his mind, certainly wasn't taught to him in medical school. That was 10 years ago. I've never had a cold or a flu since. I mean, for other people, they might take the vitamin D, and for their problem, they're low on zinc, or they're low on vitamin C. Those are perhaps the most crucial things you need to defend yourself against colds and flus. But as soon as I ticked that vitamin D box, I was healthy from there on in. So one story you hear commonly is, well, I've been so stressed, I've been working, and I just finally, after waiting so long, I went on holiday. And they say something like, I got on the plane and I caught a cold on the plane. I caught flu on the plane, must have been the air conditioning system. But, I think most of you would probably recognise that story, maybe? Yeah? So, but it isn't like that, I don't think. You see, I don't believe you should be scared of viruses or bacteria. I think that would be looking at it the wrong way, but doctors are. Doctors say, oh, bacteria, viruses, be very frightened. I don't see it that way. Those sort of people might get on the plane with a mask so they don't catch the viruses on the plane, but this is what's really happening. The body's got so stressed, it just keeps going, and it's when you get on the plane, you sit down on your seat and you go, oh, I've made it. It's still a stress when you're going through the checkpoints. When you're on the plane, you really have made it, right? And it's at that moment the body goes, hooray, time to detox. And out comes the snot, the gums, you get a temperature, so you burn off all your viruses. But the thing is that what if the body has called in those viruses to help detoxify you? We think that we've caught this virus, or the virus has got us. But I don't see it that way at all. I think the body is infinitely intelligent and would have invited in those viruses, because those viruses do a good job. The viruses get activated, the body heats up. Now you're running a high temperature. Now, cancer cells can't survive over about 43 degrees. They can't survive. You can survive up to 48, 47, 48, something like that. So, many viruses can't survive heat. Many bacteria can't survive heat. So the idea of a high temperature, it's a really useful thing, because at high temperatures, you're well. That's why saunas are powerful things. So everything happens for a reason, even though it may seem like it's negative, like the cold or the flu. Now, about 7 years ago, I realised, well, what we all knew, that occasionally there's this thing called spontaneous remission, where somebody's got a cancer the size of a basketball, and every doctor's seen this if they've been in practice long enough. Every doctor's seen it, where suddenly this thing shrinks to almost nothing in days, hardly possible. They call it spontaneous remission, and then suddenly the person's magically got better, and they can't explain it. So I got really interested and wanted to know why some people get better. I wanted to know what they did right. So I thought it might take quite a long time. I started reading autobiographies of the survivors and watching YouTube videos and whatever. But it was obvious what the key was right away. It was gratitude. And this wasn't at all what I was expecting. The answer to being cured was gratitude. And they all said the same thing, basically. They said, when this horrible disease, or whatever it was, first got me, my response was, I'm so young. This is so unfair. Why is it me? Why isn't it somebody else? Why isn't it some bad person? You know, what? I've got so many children, grandchildren, you know, I can't die now, I'm too busy. And so it's all about anger and sadness and, you know, woe is me type stuff, as one would imagine. And then they all said, well, actually, at some point I found myself saying stuff like, well, I'm glad that I got the cancer because, and then you've got a whole host of reasons. I divorced the wife, I left the husband, I got over being raped as a child, I forgave the person, I made it up with my children, I made it up with my father, whatever it was. They said, well, I'm pleased it happened because now I'm a better person. I've grown, I've changed. And so my advice to anybody that's ill these days is jump straight to the gratitude section. You know, just even if you can't understand why you should be grateful, try and express that emotion, because at the end of the day, as people, we only have two states. We're either in the fear state, where we look back at the past and it's all frightening, and we look forward to the future and it's all frightening. We open an envelope where there might be a bill and everything's frightening. Or there are those times we're in the opposite of the fear state, which is the love state. And in the fear state, you can't remember what it was like to be happy, really. When you're in the love state, you can't really remember why you were upset. And you can't be in both states at the same time. It's like a switch. You're either in the fear state or the love state. Then you can see people who are in the love state. They are riding the crest of the wave. The luck seems to happen to them. They seem to meet the right people at the right time. Everything flows. And then there are people in the fear state, and they're trapped, and everything looks very bleak. And when I realised this, what happened was, about 15 years ago, I was in deep depression, really feeling at the end. I couldn't figure out what to do with my life at that point. Everything seemed to be falling apart. And I remember I was sitting on the floor, actually, in a bit of a heap, and the phone rang. And I was so miserable, I didn't really know whether I wanted to answer, but I decided I would. And it was this really fantastic, sexy girl on the other end of the line, and within about 1 second flat, I'd gone from the deepest depression of my life, virtually, to ecstasy. Right? And I knew that there was nothing ever going to happen or anything, but suddenly I'd got caught. I suddenly realised I must be in charge of my own emotions. If a telephone call could drag me from depression to ecstasy, oh bloody hell, you know, why have I been sitting here miserable for about 2 days? And so we are in control, and we're either in the fear state or the love state, basically. And I realised that I was making some core mistakes. One of them was that I was making assumptions in life. Something would happen, and I would assume that I knew what was going on. I might assume that somebody liked me. I might assume that somebody was... Anyway, assumptions. And I put this thing on my kitchen which said, do you know what you're thinking is true, or is it just an assumption? Because I could get very depressed on an assumption, very over-optimistic on an assumption and make mistakes. So if you know what your mistakes are, because you've repeated them often enough, then maybe it's just writing something, stick it on the mirror in the bathroom, whatever it takes, so you suddenly get reminded, you know, so the thing is, if you're in the fear state, you need something to snap you back out of it. And you can set that up for yourself. Because the moment you're in the love state, things really do flow. So, how do you really want to be? You want to be bright and healthy and stay that way. So what have you got to do to be bright and healthy? Well, we mentioned vitamin D. Now, I don't supplement with vitamin D in the summer, but I do in the winter. And it's one of those things that some people need more than others. Birmingham City Hospital, for about 30 quid, do a vitamin D test by post. So you can do a vitamin D test to see what your levels are like, then you can get retested after a month and see if you need a little bit more, a little bit less, or whatever. That's about the only one that you've really got to send off a bit of money for a test. Most of the others you don't. Can I ask you, anybody put their hands up if they get any of the following symptoms? Muscle cramps, menstrual cramps, constipation, panic attacks, anxiety, any of those? Okay, so that's almost everybody in the room, almost every single person, and essentially the chances are that you're all going to be suffering from a magnesium deficiency. Okay? Now, is it just you, or is it everybody in the country? Is everybody in the country pretty much? Now, magnesium is incredibly cheap. In the old days, before doctors just gave out drugs as the main answer, they would say things like, go to the seaside, get that sea air, which would be full of ozone and it would be full of iodine. And the sea air was really good for people. A lot of people perked up. Then sometimes they'd say, go and take the mountain air. Go up into the high Swiss mountains, for instance, and walk about and you'll be better. Now, what was special about up there? Well, what was very special was there were actually dairy cures that they did in Switzerland, some of the high mountain valleys, because those cows were wandering around in the forests and eating the wildflowers and the herbs of the high pastures. And up there, the Swiss were really eating a lot of bread and cheese and a lot of butter, because not a lot grew, it was very high. They were eating a sort of diet that we would be told would be wrong now, right? Bread and cheese and butter and cream and all that. But people were being sent there for a health cure, and it worked 150 years ago. Then the third option is the doctors say, look, go and take the waters, go to a spa. And people with arthritis and so on, they'd go off to the spas, and maybe for 10 days or something, they'd wallow in the water most of the day, and miraculously all their ailments like arthritis would disappear. What was special about the water? The magnesium. All the famous spas, like Baden-Baden and so on, magnesium-rich waters, just like floating in the Dead Sea, right? Magnesium-rich. So you can have a bath in magnesium chloride, for instance, or you can have a detoxification bath in magnesium sulfate. Lots of things you can do. You can have magnesium chloride as a spray. They call it magnesium oil. And you spray it on your skin and you just rub it in. And anybody who's got those symptoms that we mentioned, magnesium will almost certainly sort them right out. And let me try and explain how and why it works. Now, magnesium allows your muscles to relax. And in fact, magnesium allows every cell of your body to relax. It's the most important mineral of all minerals. And it's common as anything and really cheap. So, what do they do in the emergency room when somebody comes in having a heart attack? What do? Because the emergency doctors are the best. Their job is to save your life. It's not the job of the GP. So the emergency doctors know what they're doing. What do? Somebody comes in having a heart attack, they inject them with magnesium in the form of Epsom salts, magnesium sulfate. What do if somebody comes in having a stroke? They inject them with magnesium sulfate, Epsom salts. What do if a woman trying to give birth gets preeclampsia? They're cramped up, they can't give birth. What do? They inject them with magnesium, Epsom salts. Right, so here we got this thing, stops heart attacks. You'd think that the GPs would have heard about this and be giving you magnesium as a preventative. That's what you'd think. I was lucky enough to meet this young girl who was, I think, 5 weeks or 3 weeks away from her final exam to become a GP. I asked her, what do you know about magnesium? What have they taught you? She said, absolutely nothing. Nothing. And it's the top thing they use to save people's lives, and the GPs know zero, or in this case. I mean, you can't make this rubbish up. If everybody took magnesium, what would it do to the heart attack rate? What would it do to the stroke rate? What would it do for, say, constipation? So, a bowel movement is like, they call it peristalsis, where there's this pulsing and it sort of pushes everything round. So, if you've got enough calcium, you can contract, but if you haven't got enough magnesium, you can't dilate. So most people with constipation, they're cramped up. Now, so In the old days, the people who are old enough will recognise the term, it went through me like a dose of salts. If people were constipated, my grandparents used this sort of phrase, if they were constipated, they'd take some Epsom salts, maybe half a teaspoonful in water, and it would go through them like a dose of salts. And everything would start moving. So because everybody is low on magnesium, people aren't having the 3 bowel movements a day that might be considered normal. So a lot of people don't have one a day. I met somebody the other day who hadn't had one for 2 weeks. Now, you're looking at colon cancer there, you're looking at Crohn's disease, you're looking at ulcerative colitis, whatever it is. If you don't have a bowel movement every day, you're in danger of all sorts of bowel diseases and problems. It's a real risk. So how do you cure constipation? Well, it's easy. Make sure you're drinking enough water. Make sure you're eating enough natural oils, so it's a bit slippery, and make sure you've got enough magnesium, and everything's going to be fine. You know, women who are getting menstrual cramps, this is usually a magnesium deficiency. It could also be other things like a zinc deficiency, an omega deficiency, a vitamin D deficiency, there are other things. But magnesium is super important. It comes in spray bottles like that. It's also worth considering taking it internally, you know, maybe in the form of capsules, or we can just spray some of that into water and drink it, or spray it on food. It adds a salty taste to food, and if you spray it in water, it makes it slightly sweet. It makes the water go soft, so it's much more drinkable. If you take too much magnesium internally, then you get diarrhea, which is why a lot of people like to spray it on, because it doesn't go anywhere near the bowels at all. So magnesium will save so many lives, it's ridiculous. And if the NHS bought it wholesale, it would cost next to nothing to, just like vitamin D, next to nothing to supply. For 10 quid you could buy a year's supply of vitamin D. I mean, it's so cheap, it's silly. Magnesium is very cheap as well. So, what else is important? Well, another really big one is vitamin C. And I would suggest that vitamin C is the biggest kept secret of the lot in the health world. Right? It's the big secret. And, you see, back in the 1940s, medical doctors were curing infectious diseases like polio with vitamin C. I had a friend who had a metal caliper on his leg because he'd got polio, and his doctors hadn't been taught that vitamin C could have reversed this guy's polio. So, over the decades, since 1940, they realised that smallpox could be cured with vitamin C. They realised that every infectious disease that currently vaccines cover can be reversed by vitamin C. This is what the medical doctors found. And, but the doses were extraordinary. In some cases, they were taking 50 grams of vitamin C and putting it in intravenously in a drip. In some cases, up to 200 grams of vitamin C. It's like a sort of bag of sugar, straight into the veins. But they were bringing people back from the dead, essentially. People had 24 hours to live, suddenly weren't dying. And, but high doses. Now, if you take too much vitamin C, just like taking too much magnesium internally, you can get diarrhea. But of course, for some people, that's part of the reason they're constipated in the first place, because they've got mild scurvy through lack of vitamin C. So how many of us have got scurvy through lack of vitamin C? Most of us. Most people have got scurvy and they just don't know it because they don't know what the symptoms are like. The symptoms involve skin cracking up, amongst other things. But if you're low on vitamin C, you're going to have eye problems. If you're low on vitamin A, the people who get night blindness, they find driving at night difficult, for instance. That's the vitamin A deficiency. When there were measles outbreaks decades ago, when the intelligent doctors would treat a measles outbreak with vitamin C. Right? Vitamin C will stop measles, easy. But if a child, say, had got measles and they were late in being treated, one of the risks of measles is children can go blind. So they discovered that when they gave these blind children vitamin C and vitamin A, their sight came back and they could see again. Right? So, for over 15 years I worked in ophthalmic optics, that was my field, and then I got very interested in neurosurgery and started working in that field for a little bit. And when I was working in ophthalmic optics, I used to hear about alternative treatments to glasses and, you know, ophthalmic operations and so on. And one of the things I came across were these.
They are brilliant.
They are brilliant.
They're brilliant. I'll be that. Brilliant.
So these are pinhole glasses, and I'll pass them round so you can try them. You know, if you normally need reading glasses, for instance, or you have difficulty looking into the distance, you just look through this sort of one pinhole of each in each lens, and you'll find that you can focus without glasses right up close like you could when you were young. And when I first started giving these to my clients, I was expecting a year or 2 years to pass before people came up to me and said, you know, I've been using those glasses and they're quite good. 2 weeks after I started handing them out, people came back to me and said, my vision's improved. And because I'd been in ophthalmic optics, where I've been told all this sort of stuff is all rubbish, I was quite surprised. It wasn't rubbish. And they only cost 10 quid or less. And they really work.
You want to sell them?
Sorry?
You want to sell them?
Daddy's got a pen.
Huh?
I've possibly got
I'm,
a pair
I'm sick of
in my
these,
bag.
mate. Yeah.
So they really are very interesting. And you see, there's so much free cures out there, one way or another. Another great one is to get some bricks and prop up the head end of your bed by 6 inches. Right, so now your head is 6 inches higher than your feet on a constant slope. I had this guy come to me about a year and a half ago who was sleeping rough on the street, and he had been a very fit guy in his youth. And when I met him, or he found me, his dream was to become world champion boxer. He was 42 then. He wanted to become world champion boxer at 43. I think that was, maybe it was 41, 42, I can't remember. Anyway, last month he won the WBF World Championship, and he put it down to 2 things. One was, I told him about nutrition and supplementation. He reckoned that brought his health back up. The second thing he credits with it is the inclined bed. Raising the head end of the bed by 6 inches, he reckons was incredibly important. And the reason why it's so important is that it changes the blood pressure, amongst other things. So if you incline your head slightly higher, your arterial pressure goes up and your venal pressure goes down. So anybody with varicose veins, you know, veins that are sort of bulging, if they put the bed up, they'll drop the venous return pressure, so there isn't as much pressure pushing the veins out, and the veins will go back in again. Right? That's just one thing. Men who are getting up to pee in the night often don't have to get up and pee in the night anymore. Check out inclined bed therapy. On YouTube, some of you might know, I've got a couple of 100 videos, and one of them is called Inclined Bed Therapy, where I did an interview on the guy who sort of figured this out, and he explained why it works. And of course it costs nothing. The guy who thought this up says, if you haven't got any bricks around, just use something totally useless like old medical books. So, what else is free out there? Water. Right, so 99% of the molecules in your body are water molecules. Right? So, you know, the brain, for instance, is, if you're young, about 80% water, the eyes, something similar, but the scientists reckon that most of us are 10% dehydrated. So if you're 10% dehydrated, how well are you thinking? If 10% of your brain is literally missing, how well are you thinking? If 10% of your eyes are missing because you're dehydrated, how well are you seeing? You know, how well is any part of our body doing? So what about people with high blood pressure? Well, imagine you're dehydrated and your blood should be nice and thin and flowing all lovely.